I can even recognize Malia, so that's good.
And I am recording.
Okay, so we're going to start off. If you could tell me your name and position and affiliation, and start off by saying my name is.
Right. My name is John Clymer, and I am Executive Director of the National Forum for Heart Disease and Stroke Prevention.
Great. Thanks for being here today, John. I want to talk to you about the National Forum and why it's so important in combating heart disease and stroke prevention. If you could tell me in your own words why it's important.
So, heart disease and stroke are the leading cause of death in the United States, and in, I believe, every state of the country and in most communities. So it affects communities, it affects families, it affects employers, it affects our military, it affects our first responders, it affects every facet of our society in ways that we may not recognize every day. And the National Forum was started by CDC and the American Heart Association and other public health organizations to bring together all the people who touch populations from all the different angles that I just mentioned, and to be a hub and a spark for collaboration across the public and private and nonprofit sectors. So the National Forum uniquely brings together people who don't usually sit across a table from one another to find common agendas, to identify strategies that are in alignment and pursue them together, or to accelerate them, and to get everybody rowing in the same direction to reduce the burden of heart disease and stroke in our country.
That's wonderful. There was a report that came out today at the National Forum meeting, and it's very startling in that the rates of heart disease and stroke prevention are not decreasing like we'd like them to. How does a meeting, a coming together of the National Forum members, how do you work to change that?
Right, so that report shows that after decades of consistent progress and reductions in the death rate from cardiovascular disease, we've actually seen a leveling off, which is disappointing and of course has all kinds of implications for society, for employers, for the healthcare system and communities, and even for families and individuals. So how do we change that? How do we get back on that downward glide slope that everybody wants? Well, we do it, we can't medicalize our way out of it, right? There aren't enough medical procedures, there aren't enough resources, there aren't enough pills that by themselves they can create health. Health takes a mosaic, it takes a complex approach, and it takes families, it takes good nutrition, it takes clean air, it takes the freedom and ability to move, to get up off of chairs and move around. It takes support, it takes personal relationships and connections and a sense of community. It requires all those things, plus access to quality, affordable health care. And this is the place, the National Forum is where all those things come together. So at the meeting we're having today, for example, we have one of the leading mayors in the United States. We have one of the senior-most officers in the entire armed forces. We have business people, we have physicians, we have public health experts, we have patient advocates, we have community organizers, we have thought leaders and researchers. We're bringing all these people together to join forces and to identify strategies that can be pursued together that perhaps no individual entity by itself can carry out effectively. But coming together collectively, we can create a lot of impact.
How critical is it that we come together to reduce heart disease and stroke prevention, to reduce heart disease deaths and prevent strokes?
Well, how critical is it that we come together to reduce the burden of heart disease and stroke? It depends on whether we want to reduce it. If we're sincere about it, if we really want to prevent cardiovascular disease, it's a necessity that we come together.
And the National Forum helps us come together.
The National Forum is built to be not just a hub, but a catalyst for collaboration, for bringing about collective impact, and to get lots of different individual organizations in the boat together and then rowing together in concert and in the same direction.
Wonderful.
All right, are we good? I gotta hightail it downstairs. All right, thank you. Thank you both.
Some